All right, let's talk about something that affects millions of women, but often gets pushed into the shadows: painful sex, or what doctors call dyspareunia. Today, we're going to break down what causes it, and more importantly, look at the very real pathways to feeling better. First things first, you need to know just how incredibly common this is. A staggering 3 out of every 4 women will experience painful intercourse at some point. So if this is something you're going through, please hear me on this. You are so far from alone. It's a shared experience and one we absolutely need to be talking about. And let's get this straight right from the top with the most important message you'll hear today. This is not just in your head, nor a personal failing. It is a legitimate medical concern with identifiable physical and psychological roots. This idea is everything because it moves us away from shame and puts us on solid ground, ready to look for real solutions. So, let's unpack that a little. We've established that this is common. But you know what? The most powerful part of that is realizing it's also treatable. This is not a life sentence. It's not something you just have to grit your teeth and endure. So who's most affected? Well, if you look at the numbers, a really interesting pattern pops up. We see 2 big spikes, one with younger women and another with women over 55. And that's no coincidence. It points right to the huge role that big hormonal shifts play, both at the start and near the end of our reproductive years. So where do you even begin to figure out what's going on? Well, your body is actually giving you some powerful clues. Learning how to decode these signals is the first step, and it'll arm you with the right information to have a really productive conversation with your doctor. Okay, the big question is, where does it hurt? Is the pain right at the entrance, kind of superficial? That often points to things like lubrication issues, a skin condition, or even muscle tension right at the opening. Or is it a deeper ache that you feel with thrusting? That usually signals something going on deeper inside the pelvis, maybe endometriosis or issues with your ovaries. Nailing this down is a huge first step for any doctor. And that brings us to the many potential root causes. Look, it's hardly ever just one simple thing. More often than not, it's a complicated dance between physical, hormonal, and even psychological factors, all playing off each other. So let's dive into our first group of causes, and that's all about hormones and how they affect your tissues. Think of estrogen as the MVP for keeping vaginal tissues healthy, thick, stretchy, and well lubricated. So when those estrogen levels drop, things can change, and fast. And there are a few key times in life when the estrogen can take a dip. Menopause is the one we all know about, but breastfeeding does it temporarily too. Even some kinds of birth control or certain cancer treatments can lead to what's called vaginal atrophy, which is just a medical way of saying the tissues get thinner, drier, and less elastic. Next up, infections and inflammation. When you've got an infection, your body's defense systems go into overdrive, and that inflammatory response makes the whole area super sensitive. Something that should feel good can suddenly become really painful. We're talking about a whole range of usual suspects here, from yeast infections and BV to STIs and even UTIs. And a lot of the time, pain during sex is one of the very first red flags your body waves to let you know an infection needs to be dealt with. All right, next up, we're going to look at the actual muscles and structures inside the pelvis, because sometimes the pain isn't coming from the tissues, but from the pelvic floor muscles themselves, or from the way your internal organs are positioned. Now, a really important one here is vaginismus. And what's absolutely critical to understand is that this is an involuntary muscle spasm. It's a reflex. You can't just will it to stop. Your body is basically hitting the panic button and trying to protect itself from pain it's either feeling or expecting. And it creates this barrier that makes penetration painful or even impossible. And there are other structural things that can be at play too. Endometriosis, for instance, can cause a really deep, searing pain. Sometimes, the pelvic floor muscles themselves are just too tight all the time. That's called dysfunction, and they can't relax enough. And things like ovarian cysts, fibroids, or even internal scarring can cause pain when they're bumped during sex. Finally, and this is a big one, we absolutely cannot ignore the mind-body connection. The link between what's going on in our heads and how our bodies respond sexually. It's just incredibly powerful. I mean, think about it. When you're stressed or anxious, what happens? Your muscles clench up, and that includes your pelvic floor. Your body doesn't produce as much natural lubrication. If there's past trauma, your body can hold on to that emotional pain and express it physically. And here's the kicker. Once you experience pain, the fear of feeling that pain again can kick off this vicious cycle of more tension and, you guessed it, more pain. Okay, so we've talked a lot about the why, but now let's get to the most important part, the hopeful part. What can you actually do about it? Let's talk about the pathways to relief and how you can reclaim intimacy that feels good again. And the great news is, some of the most powerful tools are things you can start trying today. First, use a good lubricant. Seriously, don't be shy with it. Second, take your time with foreplay. It helps your body relax and get naturally aroused. Third, try out different positions, especially ones where you have control over the depth and pace. And maybe most importantly, talk. Talk openly and honestly with your partner. It's a game changer. Now, these self-care steps are amazing, but they often work best when you also get some professional guidance. Getting a proper diagnosis is, well, it's a non-negotiable step to make sure you're treating the real root of the problem, not just masking the symptoms. So, what does that professional journey look like? It's actually a pretty clear step-by-step process. It starts with an assessment from a doctor to figure out the cause. From there, the treatment is tailored just for you. It might be medical, like a hormone cream or antibiotics. It could be pelvic floor physical therapy to help those muscles release. Or it might involve counseling to work through any of the mind-body factors we talked about. All right, let's tackle a really big one. A myth that causes so much anxiety and heartache in relationships. Does having painful sex mean you don't desire your partner anymore, that you're not attracted to them? Let me be as clear as I possibly can be. Absolutely not. No. Pain is a physical signal from your body. It is not a measurement of your love, your desire, or your attraction for your partner. Drawing a hard line between the physical sensation and your emotional feelings is so important for healing. So as we start to wrap this up, what are the big things to remember? 1, painful sex is common. 2, it is treatable. And 3, it is never something you should just have to put up with. It's not normal, and you deserve to feel good. And I want to leave you with one final thought to chew on. We tend to think of intimacy as a purely physical thing, but what if the first, most powerful step you can take toward reclaiming it isn't a physical act at all? What if it all begins with a single conversation? With your partner, with your doctor, and maybe most importantly, with yourself?